Welcome to HealthWatch, presented by Novant Health. I'm June Baker, and I'll be your host today. We have a very special show planned for you today, and it's celebrating the one-year anniversary of New Hanover Regional Medical Center joining the Novant Health family. So we're all really excited here at Novant Health Brunswick Medical Center. Our guests include Shelburne Stevens, who is now the president at New Hanover Regional Medical Center and of the Novant Health Coastal Market. And our second guest will be Laurie Whalen, and she is the current president here at Novant Health Brunswick Medical Center, as well as the chief operating officer. So stay tuned to learn about these and other topics on HealthWatch. Our first guest today is Shelburne Stevens, the president of New Hanover Regional Medical Center and Novant Health Coastal Market. Thanks for getting back to us. I've been missing you so bad.
It's good to be back down here.
We
Jen.
needed to get you back here. We all have been just wondering how you're doing.
I'm doing very well.
Good. Well, let's start with COVID-19, the big elephant in the room. So, our hospital has been just inundated with COVID and with just patients in general. How about New Hanover?
It's the same. We have been full. We've been holding next to 100 patients a day in our ED waiting for a bed, and then being the regional transfer center, we have patients out in the region, but just seeing extremely high volumes. Not quite as high as we saw last fall.
Yeah.
Thank goodness. That was a bigger surge, but we are seeing a lot of folks this time around.
Yeah. It's been crazy here, but our team has really stepped up, as yours has, and
they have been amazing. They have stayed focused on their patients
Yeah.
and the families and taking care of them, and while also trying to protect themselves and not catching themselves. That's been a big risk this time around.
And I know that Novant Health helped out here locally at Brunswick. How about at New Hanover with supplies and equipment?
Absolutely. Last fall, both hospitals were getting very close to needing more ventilators. And
Right.
fortunately, with the logistics center in Kannapolis, we're able to bring some ventilators down here to help support both facilities so that we had enough to meet the demand.
Yeah, the morning calls are interesting when everybody tells us what they need. They need this, they need medication, they need beds, stretchers. So it's pretty interesting in the morning.
Yes.
So. Let's talk about vaccines. How's that going?
Vaccines has gone very well.
Yeah.
Together with New Hanover and Brunswick for the region, we've been able to vaccinate over 116,000 people.
When I saw that number, I couldn't believe it.
It's huge, and a lot of people now are getting their boosters, which is good with this new variant being so contagious. So we're still working with local health departments to get as many vaccines out there as we can.
How about equitable access? What do you think? Are we getting the vaccines to the people who really need it? Are we?
Absolutely. We've been working with several of the marginalized communities about having events in their areas. We've turned a lot of that over to the health departments now.
Right.
But prior to that, we were working with churches and other civic groups to really go meet the patients in their community so that they don't have to travel for a vaccine.
Yeah, I'm hoping we don't end up in the parking lot again. I'm hoping we. Do you remember those days?
There were some good days when it was warm, but there were some rough days when it was cold and rainy.
Really bad days. When you showed up, it always rained.
It did always rain. I had a black cloud, so to speak, over me.
So to speak.
But we
Shelburne.
made the best of it.
We did. We had fun, and we did a good job.
We did.
Yeah. The next thing I want to talk about is sharing some experiences. For many years, you were the president here at Brunswick Medical Center, and then you got even more responsibility when you became the president at New Hanover Regional Medical Center. And that's a pretty big team. That's a lot of people. I couldn't believe that number either when I saw it. 8,400 team members?
Yes, in the coastal region now we have a little over 8,400 team members. It's actually been a pretty easy transition. The team there has been very welcoming to me.
Really?
I've enjoyed getting to know the team members and the providers and what their needs are. And really it was seamless because our atmosphere and environment was so similar. We're all focused on improving the health of our communities one person at a time. So it was an easy transition to make up there, and then working together as a region to take care of our communities has been really easy.
Yeah. Both organizations were so well respected, and that made it easy, I think, for the community. I still think we have some opportunity out there to help people understand that we are one and the same now.
Absolutely. And that's where we're working with bringing more specialists down here to Brunswick where we can, and been keeping patients here local for their health care. And we've still got a lot of work to do. It's still only been coming up on the first year, but we've gotten a lot of work done.
And I think I read in the paper where you all built a Habitat for Humanity house?
We did. New Hanover has for years done a Habitat for Humanity house that they do for one of their own team members. And
That's
so
what's
this year we were able to let the Brunswick team come and enjoy building the house as well, and got to meet the team member on her house. So it was really awesome.
That's really special when you could do it for a team member.
Absolutely.
I would love to see that happen here in the Shallotte or Supply area. Well, it's the end of year one. We've had our first year, and it's gone really well and pretty smoothly, I think. I'm excited about what's coming up, but let's talk about some of the highlights of year one.
So there's been a lot. I mean, who integrates a healthcare?
Do we have enough time for this?
I know. Who integrates a healthcare system during a pandemic?
I don't know.
So you double whammy there. But there's been a lot. I mean, immediately we were able to implement the healthy living wage, which impacted a little over 1,100 team members. For New Hanover to $15 an hour.
Right.
We were able to adopt our charity care policy. New Hanover's was 200% of the federal poverty level. Novant Health is 300%. So that was implemented on February 1st, which really means if you have a household of 4 with an income below $78,600 and no insurance, no access to insurance, you don't receive a bill from us.
To me, that is truly amazing. I think that's one of the best things Novant Health ever did.
Yeah.
How about the Leapfrog study?
So that's probably the biggest thing that we've done. Is Leapfrog is a national score for all hospitals in the U.S. that grades you on your quality and safety programs and meeting certain metrics. And both New Hanover and Brunswick Medical Center were A's this past fall, so we're very proud about that. As a matter of fact, all of our Novant Health hospitals were A's for the first time.
Yeah, I've seen billboards to that effect, and we're so proud because quality is a huge focus area for us. We've always been all about the quality, so to be recognized by Leapfrog is pretty amazing.
It is.
Tell me about physician recruitment.
So we've had a lot of activity around there. There were some commitments in the asset purchase agreement to meet some of the needs, and we're well on our way to hit that commitment in year 2. We've had around 25 or so that have actively been recruited and started, and another 30 or so that are coming in the next few months.
Yeah, there just are too few physicians, and it was hard to believe we got along with so few for so long.
Absolutely.
So that's a really huge, a huge thing for us. Tell me about your stroke program.
So we've had a strong stroke program at both facilities, and Brunswick has been stroke ready. New Hanover has been the regional referral center there. So that continues to grow, but we were able to add artificial intelligence with the merger, Viz AI, to the CT machines. We've had it at Brunswick now for a couple of years, which means if you come in with symptoms of a stroke, we scan you. The device on there automatically senses the bleed and sends a text message to the team, including the provider, and we're able to start treatments immediately.
So that means the provider knows immediately. He's still not here, maybe. He's
yeah, he could be off-site, he could be in his office, he could be in the ED someplace else, and he gets a text with a picture of the image with all of your information. Yes.
And so we have that at both facilities.
We do.
That is really amazing. But when I read that Viz.ai, I wasn't sure what that was.
Artificial intelligence.
Artificial intelligence. Well, that's excellent. And it's impressive to hear those kinds of advancements are happening. And let's talk about access to care. I know that we've been trying to meet the people where they are. We're trying to open up more clinics. Talk to me about that.
Yeah, so one of the big steps with that is from the Michael Jordan Foundation. He grew up in Wilmington. His foundation made a $10 million contribution. And we'll have 2 Michael Jordan clinics opening in roughly around 2023, 2024 in the Wilmington area. And we're beginning to assess where there might be other clinics in the future. But those are in neighborhoods where there is no access to health care. And we can bring that locally to those communities. And then in addition, we're always looking at where we have our primary cares and where there's gaps
Right.
and how we recruit more to there.
The Michael Jordan clinics, are they at opposite ends? Where are they located? At what areas?
They're in different areas of Wilmington at different addresses, kind of more in the central area, but
Okay.
it's underserved populations.
Well, that's great. Do we have something coming up in 23 or 24 with new clinics? And
We have lots of different clinics that will be coming up for sure. Michael Jordan will hopefully open in those 2 years there. In the meantime, we're looking at a mobile clinic that could go on site and then eventually travel throughout the region as well.
wow, lots of things going on, huh? Talk to me about the partnership with UNC.
So that's going well. It's 2 pieces to that. There's one that's around the residency program
Yeah.
that was already at New Hanover, but we've committed, along with UNC, to expand that program to bring more residents to the region, and hopefully they would love the Wilmington area and want to stay here and practice. And then the other side of that is around pediatric services, along with our medical group and bringing pediatric specialists to the region to help meet the needs of the pediatric population.
Yeah, that's a big thing. I'm real excited about that. I was talking with someone the other day, and it's so nice they don't have to travel
Exactly.
to anywhere else, because we're going to have that caliber of physician right here locally, and
Absolutely.
so that's going to really help augment the pediatric practices and stuff
Agreed.
around the area. Let's talk about what's on the horizon. A lot, I know, and we've got another hospital coming up. So tell me about the growth and the facilities.
Yeah, so COVID has just expedited the population growth here. Everyone's moving out of the Northeast, and
They're coming
so,
here?
Yeah, they're everywhere. So we did get a certificate of need approval for the Scotts Hill Community Hospital, which is in the north end of Wilmington.
Right.
We'll be breaking ground on that soon, and hopefully open that up by the end of 2024. Along with that, be a medical office building on campus there. That's also located where our freestanding ED is, so the hospital
Yeah,
will
I
be
know where
built
that is.
around that. And then here in Brunswick County, we're going to be breaking ground to build a new medical office building here at the hospital campus to help us expand some of those specialty clinics and access to care here for the Brunswick community as well. Novant Health is committed over the next 10 years, a lot of money, several hundreds of millions of dollars in capital investments to help grow the healthcare services. So we're committed to doing that over the next several years.
Yeah, Laurie's going to be with us later today, and she's going to talk to us about that North Tower, or about the neurosciences patient
Yes.
tower. So that's really exciting.
It is very exciting.
Yeah, and I was, when I came to work the other day and I saw all the, there's paint on the roads and all those flags and out in the yard and stuff where they're marking off, and it's really exciting, because next thing I know, there'll be dirt there.
That's exactly
They're
right.
going to turn dirt, so I'm really excited about that. We'll have to plan something special when that happens.
Yeah.
So. It looks like Novant Health has committed a lot of money, and they're following through with that, and that's really important. And I think the folks in the community will see for themselves what this merger has done for them and our patients in this area. But before we close, is there anything else you'd like to highlight?
Really, we're just excited about being able to expand access to health care for the entire region. We've pulled out Legacy New Hanover and Legacy Brunswick Medical Center master facility plans, and we're looking at those as a region now of where there's gaps in services and where there's opportunities to add. And again, how can we bring more specialists down here to Brunswick County and other areas that we serve around here? So it's very exciting. We got a lot of work to do and a lot more integration to happen, but a lot of great things have happened in this first year.
Well, I thank you so much for coming today, and I hope you'll come back very soon. There's so many things to talk about, and we always enjoyed having you on the show. And we didn't crack up yet, or we didn't have to stop and start. We did all sometimes.
It's all those years of practice with you,
All
Julie.
those years of practice. That's what I said in my opening. We're going to have two guests today that you're familiar with, one more than the other. And so I know that our viewers are going to enjoy having you back today, too.
It's always good to be here with you.
Take care.
Thanks.
Our next guest is Laurie Whalen, the President and Chief Operating Officer of Novant Health Brunswick Medical Center. Thanks so much for being here today. I'm so excited. This is a great show.
Thank you for having me back, June. I'm very excited.
Yes, it's our anniversary.
I know,
Can't
how
believe it.
exciting. 1 year has flown by.
And it's really good to have you back because there's a lot to talk about. So you've been in your position now about 9-ish months.
I have.
Something like that. So how's that been going?
Well, it feels much longer than that, June, I will say, but in a very good way. The team members, the physicians, and really just the community members of Brunswick County have welcomed me with open arms. And so it has just been such a natural fit that it just feels so much longer than 9 months. So I'm just so excited about what we have going on here.
Well, we're really excited you're here. It was easy to adapt to you. It's been really great.
That's good to hear. Thank you.
So you joined at a difficult time with COVID-19 and our hospital being so full. So talk about some of your experiences over this last year as we battled the pandemic.
Absolutely. And unfortunately, we are going through a surge again.
Yes.
But what I can say is that just the resiliency of our team members, as well as the dedication of our team members to our patients and our community, just sort of blows me away on a daily basis. Whether it's someone coming to the emergency department and having to be treated at our inpatient hospital, or our team members standing up testing sites, administering monoclonal antibodies, vaccines in partnership with the Brunswick Health Department has just been absolutely outstanding. So they've really run the spectrum. And also our partnership with New Hanover, during the hardest of times, we really leaned on each other to partner, to share medical supplies, to share medical equipment, to really make sure we had what we needed at each facility. So that part of the partnership has been wonderful.
Yes, it has. And I've been in the ED a few times, and it's amazing. It's like clockwork. They all have a job, and they know what to do.
They've got it down pat.
I really sympathize with them. They've been through a lot.
They have. They have. So wear your mask and get vaccinated.
That's right. So I'm hoping that soon we'll see less and less COVID-19 in our community.
Absolutely.
And let's talk about some of the brighter spots during this time.
Sure. So we've had, in spite of what we've dealt with COVID,
we got some work done.
We've got some work done. So we did celebrate our 10-year anniversary this summer. So our team members did get to have a celebration, which was fantastic. And really it just, the growth that this facility has experienced in those past 10 years, I mean, just thank goodness we have this.
Oh, I know.
Because of the growing community that we've seen to be able to provide those services and access to healthcare within Brunswick County is just phenomenal.
Yeah, I don't know what we would have done if we had been in the old facility and this occurred.
Agree.
I just don't know how we would have lived through it, but.
We also held a community baby shower.
Right,
we partner with a lot of partners. We had it drive-through because of COVID, and we gave away over 14,000 diapers.
I think that was more than the year before when we were outside. I think we gave away more this year.
Absolutely. The drive-through was perfect, and we will keep that every year.
Good.
But just car seats and pack and plays and just the new moms and dads were
Yeah.
It was wonderful. They were so appreciative.
Yeah, it is a great thing. I'm so happy that we do that and continue to do that. And then I understand with one of the schools, the Brunswick County Middle Schools, they're benefiting from something we've worked on.
We have. So we partnered through our Medical Center Foundation as well as with the Duke Endowment to have a $400,000 grant that's in partnership to provide telemedicine and telepsychiatry services in our middle schools. And the goal is to provide early crisis intervention for those teens having trauma, anxiety, and we know that, and just really depression. And we know that now more than ever that services is needed. And we are very excited to bring that benefit to the individuals of Brunswick County.
Yeah, I'm sure COVID has not helped that situation.
Not at all.
At all. And do we have any numbers? How has it been received?
It's early on, so we have had, one of the great things is we've got a process in place for escalation. So if anyone needs to go to a facility, they actually come right here to Brunswick Hospital if they need that service. So we have had a few transfers, but other than that, most of it's able to maintain right at the middle school and get them the process they need. We'll be having quarterly reports, so maybe something I can update you on in a future event.
That'd be awesome, 'cause that's a great thing for our schools. What do you see as one of the major healthcare challenges that we have here in our community? And I know what you're going to say.
Growth. And we always talk about this, keeping up with the growth within Brunswick County and just southeastern North Carolina is
we're always behind.
It is our biggest challenge. But it's also our biggest opportunity.
Oh,
I think
absolutely.
if there's ever a problem that I want to
That's
have,
one you want to have, right?
that is one. And so we really need to stay ahead of the curve of growth to be able to make sure that we can keep access to health care a top priority.
I know when I drive down 211 or 17, every time I turn around, there's a new development. There's a new road cut in, and there's a new house being built. So, what about office buildings?
Yeah, so we've got 2 new medical office buildings that are currently
that's really exciting.
Very exciting, being built. One on our campus right now here at Bolivia, and then another down in partnership in Charlotte. And so that is going to be really providing expanded access to our surgery clinics, cardiology clinics, neurology clinics. We're going to be building a brand new state-of-the-art cardiac rehab, as well as brand new physical therapy space, which will include a green space and gym.
Oh, that's nice.
So those should be completed hopefully in April of this year, and then end of 22, beginning of 23 for the medical office building on campus. So we are very excited.
I was real excited when I pulled into the hospital the other day, and there's stakes in the ground all over the place. There's paint on the roads and
progress.
So it's real progress. I can't wait to see dirt.
Me too. It's coming. It's coming.
Well, we'll be looking forward to it. We need to have a groundbreaking.
I think we're going to. We're planning that right now, probably at the end of February.
Awesome. I'm so excited about that. Well, that's really great information, and it's just going to improve the health and wellness of our community so much by building and adding on this, because access to care is one of the
top goals of Novant Health for sure.
So in addition to your role at Novant Health Brunswick Medical Center, you have another role that has regional responsibilities in it. And honestly, I don't know how you're doing all this. So talk to me more about your regional responsibilities.
Sure. Well, first I do it because I've got a great team. But so
you always say that. You're so good to give compliments and give kudos to where they belong.
Well, it's the truth. So my regional responsibilities include, I have a lot of the support services. So things like pharmacy, radiology, lab, and respiratory care. And then I'm also responsible for neurosciences as well as oncology services around the region. And the goal is really to make sure that we've got those standardized throughout all our facilities, but also to make sure that we are regionalizing that access to care so that we are providing oncology services throughout our entire region, not just in one location in Wilmington. And so that's really the main goal for that role of my regional services.
I've had the privilege of meeting several of the people who oversee those departments that you just spoke of, and what a pleasure that's been. And to be able to then go out and tell the community and tell the providers in this area what services are out there and available to us now, it's a marriage made in heaven.
Absolutely.
I'm so excited about this
And I think
integration.
you've had some on the show, haven't you?
We have had a few, and that's been really successful. So I look forward to doing more of that because there's so many more I can have on the show.
Absolutely.
I've got a really great pool out there now. You mentioned specialty services such as cardiology, oncology, and neurosciences, and I'm wondering if I think there's some growth in the neurosciences area.
Absolutely.
Where you're building something.
We are. So we are currently building a neuroscience center at part of our 17th Street campus at New Hanover Regional Medical Center. And so that is going to be a 108-bed tower. And what it's going to have is its own independent neuro ICU. It's where our stroke center is going to be, as well as also our neurosurgical patients. And then what we're going to have is 4 neuro operating rooms, as well as interventional suites. These are for individuals that come in with a stroke and need to be urgently treated. It is slated to open in September of 22, so before the end of this year. So we will have an opening and a dedication to that, but it's really going to be a top neuroscience center in Southeast, and we are very excited about this.
Now, is that a separate tower from the hospital at New Hanover? Or?
It is actually its own independent tower, but it's connected through the hospital on the ground floor, so all of the services are readily available.
Wow, that's amazing. And when do you say that's going to open?
September of this year.
September. Oh,
absolutely.
just right around the corner. So we need to get those guys on the show then.
Yes, you do.
Okay. Well, before we close, what else would you like to say to our viewers out there?
Just, thank everyone for the warm welcome, and really look forward to continuing to serve the patients and the citizens of Brunswick County through this partnership and beyond.
Thank you so much for being here today. Will you come back real soon? Because
Absolutely.
I want to talk some more about the new building out here and the Neurosciences Tower and all that.
I can't wait. Thank you for having me.
I'm going to put it on your calendar.
Please do.
Thanks again for being here, Lori.
Thank you, June.
Thank you so much for tuning in to HealthWatch today. We hope you found this information to be beneficial for you and your family. If you'd like to know more about services provided at Novant Health, or if you're looking for a new physician, please visit our website at novanthealth.org. Thanks for being with us today. Be sure to join us next time for HealthWatch.
In today's world, to move forward, you must constantly evolve. That's why we're changing for the better. ATMC is now Focus Broadband. At Focus Broadband, we're building better technology to connect you to a brighter tomorrow. And while our name has changed, our commitment to giving you the very best remains the same. Focus Broadband. We're focused on you.
How much bandwidth will satisfy your home's hunger? The average household now uses 7 wireless devices a day, including TVs, laptops, tablets, and smartphones. HD streaming and gaming can use large amounts of data and slow down speeds for other users. The more devices you use, the more bandwidth your home needs. So make sure you have enough bandwidth. Get speeds up to 1 gig with high-speed internet from Focus Broadband. It's a speed you need to power all your devices. Call today.
In today's marketplace, speed is everything. Whether you're taking the order or getting it out the door, the race goes to the swift. Let's face it, this isn't your father's business, so why would you rely on his communications partner? Connect your business to something better with Focus Broadband, providing business broadband and phone solutions to managed IT services, commercial security, and digital cable, all at affordable prices. Connect your business to something faster and better. Call Focus Broadband today.
Say hello to the internet of tomorrow. Compelling, absorbing, all-encompassing. Delivered to your home at up to 1 gig. That's 1,000 megabits per second. That's fast. Really fast. All so that you can do a little of this, and a whole lot of this. With none of that. Need speed? Welcome to the Internet of Tomorrow. Today, get blazing fast speeds of up to 1 gigabit per second from Focus Broadband. Call or click to order today.